No mai, haere mai, and welcome everyone. Thank you for joining us today for today's Heart Health live session. I'm Jennifer Lean and I'm a heart health advocate here at the Heart Foundation. So this series is to offer New Zealanders living with heart disease or their whānau and friends educational content from a range of specialists and give you the opportunity to connect with experts and gain valuable advice about living with heart disease. Today we're discussing long COVID in the heart with our medical director, Dr. Gerry Devlin, and one of our nurses, Jane Liggins. So a little housekeeping before we get started. If you think of any questions during the presentation, feel free to add them into the comment section and we'll cover as many as we can during our Q&A. Please don't include any personal details that others might see. We recommend watching on a larger screen if you can, so you can see the presentation slides better. So please join us as Gerry and Jane discuss long COVID in the heart, long COVID in the heart, for the next 15 minutes, and then we'll get to your questions. So without further ado, I'll hand over to Gerry.
Thanks very much, Jennifer. And welcome again to this session on long COVID and heart disease. As Jennifer pointed out, I'm Medical Director of the Heart Foundation. I also work as an adult cardiologist in Tarafity, and with me is Jane Liggins, who also works with the Heart Group as a nurse practitioner in the Heart Group. So we feel very privileged to be with you today. And this is not by design, this is just coincidental. March 15th has been designated International Long COVID Awareness Day, and this is the first International Long COVID Awareness Day. The aim of the Awareness Day is to increase long COVID visibility, and this is consistent with that aim, to attempt to prevent further COVID infections around the world, to empower people, and I think that's a really important bit of all of this, living with long COVID across the globe, to share support and resources and learning, and to educate about the symptoms of long COVID, which we're all continuing to learn about, and we'll talk about some of those this evening and how we continue to understand a little bit more, but we probably understand less than we understand currently, and that highlights the need to fund international research around the world. Before I move on from this slide, I just want to take you through the symbol for the Awareness Day. It's got three colours that signal past, present and future status of where we are with long COVID. Grey signals loss and grief. Black, loneliness and isolation that people living with long COVID often experience. And teal, the hope and support that we hope to offer with people suffering from long COVID as we learn more and more about the condition. So post-COVID-19 conditions or long COVID affect lots of systems in the body. It often results in severe symptoms that follow infection with coronavirus. What is it? It's a wide range of new, returning or ongoing health problems that people experience after being infected with the virus. Your healthcare provider may consider the diagnosis post-COVID based on what you go and present to him or her with. Particularly if you've had a diagnosis of COVID-19, either by a positive test or by symptoms or exposure. It is recognizing as occurring at least 4 weeks post-infection, often longer than that. And anyone who's infected can experience post-COVID conditions. Unfortunately, there is no test that determines if you actually have COVID-19 as responsible for the symptoms you're seeing your health practitioner with. And there is no one illness. There's lots of conditions that come together affecting multi-systems of the body that result in long COVID syndrome. And not everybody
has the same ones.
Has the same ones, yeah, exactly. So how common is it? We believe current estimates are there is at least 65 million people affected around the world who have ended up suffering from long COVID. That's about 10% of people who have been exposed to COVID-19. This is likely to be an underestimate, Jane, I think, with the numbers, lots of undocumented cases. So I think we are continuing to learn about the incidence of post-COVID conditions and long COVID, and we'll continue to do so. As mentioned, it can include a wide range of ongoing health problems, can last weeks, months, or years, we believe. Our understanding at the moment is that they're found more often in people who have severe COVID-19 illness, but anyone who's been infected with the virus can experience post-COVID conditions or long COVID. The understanding currently is that people not vaccinated against COVID-19 and who become infected have a higher risk of developing long COVID compared to people who have previously been vaccinated. And of course, whilst most people have evidence of previous infection, in some cases people may not actually know they've had COVID infection, they may not have tested positive, and they may present subsequently with symptoms that are due to long COVID. So a bit more complex there, isn't it? It's estimated to occur in 10 to 30% of non-hospitalised cases, 50 to 70% of hospitalised cases. So you can see if you end up getting admitted to hospital, more likely to potentially develop long COVID syndrome, and in 10 to 12% of people who have been vaccinated. Can affect all ages and disease severities. The highest percentage of diagnosis is between the ages of 36 and 50. And because there are more people not hospitalized with COVID, there is more long COVID around the world, and people who are non-hospitalized who suffer an initial mild illness with COVID. So the symptoms, as we mentioned previously, can last weeks, months, or years. Sometimes the symptoms can actually go away and come back again, and they may not affect everybody the same way. So people who may develop long COVID, the journeys are all slightly different. May experience health problems, which we'll mention, from different types and combinations of symptoms over different lengths of times. And symptoms may improve with time. Really important, though, that if you've got symptoms that you're concerned about after a COVID infection that you think may relate to the infection, that you discuss these with your health professional. So lots of symptoms that have been recognised. Jane, I think the last list that we saw together was over 200, and tiredness and fatigue tend to be one of the more prominent ones that interfere with daily life. May be more pronounced after physical or mental exertion, and a low-grade fever is often present as well. So it can affect the respiratory system and cardiac, and some of the symptoms that people may be aware of are difficulty breathing, shortness of breath, persistent troublesome cough, which we talked about earlier, chest discomfort, or palpitations where the heart is beating a little bit faster or a little bit irregular. So common symptoms that may affect the respiratory and cardiac systems. One of the symptoms that we recognize as quite a common symptom is brain fog, where people have difficulty concentrating or thinking, and that is recognized as occurring more commonly in people post-COVID. They experience headaches, problems with sleep, dizziness when you stand up particularly, some pins and needles or tingling in the hands and feet, and change in smell or taste, and feeling a bit anxious or not quite certain what the future holds. Can affect the tummy, can result in diarrhea, can result in nausea and tummy pain as well. Can also affect your joints, so you might have joint aches and pains, muscle aches and pains. Some people have experienced rash that can come and go with long COVID. And for women, changes in the menstrual cycle have been described as well. So you can say it affects lots of symptoms, lots of systems, but lots of symptoms. Recognizing some symptoms that are a little bit harder to put together, but people may experience chronic fatigue or symptoms like ME, poorly understood these are already poorly understood chronic illnesses that can occur after infections. recent, which I was reading this week actually, some recent research from Australia looked at brain MRI in people with long COVID and showed quite similar changes to people with chronic fatigue syndrome, which is interesting. Not fully understand. Yeah.
Really hard to tease out what the similarities are with the post-COVID fatigue and chronic fatigue or ME, and what differentiates them. I think that's still something that's ongoing, isn't it?
Yeah. And it's a challenge for health professionals, isn't it? Trying to put all this together and then trying to work through what might be going on. You know, as we talked about earlier, there's no test that we can do to say this is due to long COVID. So it's important that we all understand this better, that we actually understand a way to work through this and work out what's not going on as well. That's really important, which we'll talk about a little bit, I suspect, during some of the questions. We know that people that have had COVID in the medium to long term may be prone to developing more heart conditions, particularly myocardial infarction. Heart attacks. They may develop blood clots in the legs or the lungs. They can develop other neurological conditions. There appears to be an increased incidence of diabetes, both type 1 and type 2. Now, whether it's the COVID that causes it or what, we don't fully understand that. And we're recognizing this more and more with long COVID, that people's venting mechanism can be a little bit more sensitive, and we don't fully understand this either. One variant of this is a condition called POTS. Jennifer? POTS?
I'm not going to explain what that is. You can.
Well, basically, my how I understand this is that, simply is that due to cardiac deconditioning, when you stand up, there's an exaggerated response with the heart rate to try to maintain a blood pressure to perfuse the brain, to keep the blood going to the brain. And that heart rate response may result in a feeling of dizziness, a feeling of palpitations, and occasionally fainting. Yeah. So a condition that we've recognized for a wee while. We're seeing more of it with long COVID as well.
Yeah, it seems to be quite predominant, and to explain it quite simply, as far as I understand it, correct me if I'm wrong, Gerry, it's sort of, if your body has certain systems that you do automatically without you having to think or do them, like breathing, and adjusting your blood pressure and heart rate from sitting to standing, so working against gravity. When you have dysautonomia, which means that the automatic system that would do it automatically for you doesn't work properly, it almost becomes OP or overpowered, as my sons would say, and it overcompensates by increasing your heart rate too high for too long and giving you those symptoms of feeling really.
It's a good explanation. Good explanation, better than mine. So who are the people more likely to develop long COVID? We mentioned earlier in the presentation, if you experience the most severe COVID-19 illness, particularly if you were hospitalized and needed intensive care, what we understand currently is that you are more likely to develop a long COVID syndrome. People who have other underlying health conditions prior to COVID-19. We believe vaccination helps and reduces the likelihood of developing a long COVID syndrome. Around the world, we believe that people who are at risk of health inequities are more likely to develop long COVID. That's particularly relevant, given the fact that we saw the burden of COVID falling unequally in our populations in New Zealand, Māori and Pacific. So important that we, look at what's going on in that space in New Zealand. And people who have got, again, a more complex presentation where there's lots of parts of the body involved with the initial presentation, with lots of inflammation during the initial COVID illness. So lots of questions. I think at the moment there's more questions than answers with a lot of this, and the ongoing challenges that have been investigated and researched around the world is to try and understand the symptoms and try to work out how many people are actually affected by post-COVID conditions, try to understand the risk factors, which groups may be at more at risk, and if different groups experience different symptoms. So women experience different symptoms from men. For example, we've got some pointers to some of that at the moment, but we don't fully understand it entirely.
Gerry, another question with this is there's lots of obviously overseas international research, and being quite unique in New Zealand in that we had a population who really we didn't have a lot of Delta, but we did have a lot of Omicron, which was seen to be a more milder mutation of the COVID virus. Plus, unlike a lot of the America and Europe and overseas countries, we were largely a vaccinated country before we got large numbers of COVID-19 infection. And we've got our own research going on, haven't we, just to look at our unique situation?
Yeah, absolutely. Yeah, there is. I mean, there's research going on all around the world, but our experience is different, isn't it? With as you mentioned, that highly vaccinated population. So I think it'll be interesting to see what long COVID looks like in New Zealand as time marches on. So the ongoing challenges help understand post-COVID conditions and how they impact on people's daily living in our own country. Help identify groups that have been more affected by post-COVID conditions, particularly if you've got difficulty with access to healthcare, such as we've got around the country, magnified at the moment given the issues that we've had post-cyclone. Better understand the role vaccination plays in preventing post-COVID conditions, and collaborate around the world to share learnings, not just as health professionals, but as patients and people who are suffering from long COVID, and that's coming back to the International Awareness Day. That's one of the aims of that as well. So finally, preventing long COVID. We mentioned the benefits of protecting yourself with vaccination, public health measures, and family and friends. Protect yourself and others from becoming infected with public health measures and vaccination.
So that's your distancing, and if you have a cold that you're not sure, or symptoms that you think might be COVID, you haven't tested or are about to test, or using your elbow and all those sort of, wearing a mask if you think you want to, and that sort of thing.
Yeah. So in New Zealand, where to go for support? With our Heart Healthline, the numbers provided there. Please, if you've got concerns about symptoms, about your own health, please consult a healthcare professional. We know it can be a little bit challenging up and down the country at the moment, but if you've got symptoms that you are concerned that aren't going away, then please make an appointment to see your healthcare professional. And the last couple of resources at the end there, the COVID-19 Healthline with the hashtag, and the Long COVID Facebook support group. So we're going to stop the formal presentation and we're open up for some questions.
Awesome. Thanks so much, Gerry and Jane. Really informative.
Excellent.
Yeah, good food for thought.
Yeah, while we're waiting for here we go, the questions have already come up, so I'll leave you, Jen, to ask those for us.
Also,
these are the ones that are coming through, aren't they, from people?
I'll just say as well, just a reminder to put your questions into the comment section. So we've got one here through from Gary. So Gary's asked, are the impacts of long COVID any different for people who've been vaccinated versus those who haven't? And what's the Heart Foundation's view generally on COVID vaccinations?
Yeah, really good question. Thanks, Gary. I think we touched on this a little bit during the presentation. Our understanding currently is vaccination reduces the likelihood of developing a long COVID syndrome. What we don't fully understand, does it result in a mild, if you get it, are you likely to have a milder form of long COVID? I think that's some of the learnings that we will get as we find out more over the next few years. Our views generally in COVID vaccination, we strongly recommend COVID vaccination. There is no doubt from the literature available that if you are vaccinated, you are less likely to end up in hospital. You are less likely to have a severe illness and less likely to end up in intensive care. So we strongly recommend vaccination.
Less likely to die.
less likely to die.
Okay, so Terry asks, should you exercise when you have long COVID?
Oh, Kerry, that's a really good question, and I'll give you sort of a general answer, but of course I don't know your specific long COVID symptoms. But generally, yes, absolutely. It's certainly not while you have acute COVID, so not when you actually have COVID-19 infection at the time, but once you are better, and although of course you're still experiencing some symptoms of long COVID, it's actually really important to do a sort of a staggered exercise program. So we recommend that you start off, and this is through also research and literature, some sort of an international type consensus, with 5 to 10 minutes a day, each day of the week, and gradually each week increase that by 2 minutes per day. So if you start off at 5 minutes a day for the first week, you can do 7 minutes the following week and continue on that, particularly if you have quite severe symptoms of long COVID, such as fatigue and shortness of breath and palpitations or that sort of thing. The reason why it's really important to exercise, even though you don't really feel like it, is that if you don't, you end up in this sort of spiral. We call it a deconditioning spiral. And what that means is that your symptoms, which are often things like fatigue, lack of energy, you're not exercising because of that, your heart rate might be a bit faster, you might be suffering from some palpitations, or maybe dizziness, you don't actually feel like exercising. And so what you end up doing is you end up doing less and less because you're worried or you're scared you're going to make things worse. And you end up, your heart's a muscle. It's just like any other muscle in the body. It needs exercise. So it ends up deconditioning. So you get less fit, you weaken your heart muscle, and of course that then worsens your symptoms. You feel even more tired, and you are less feeling like exercise, and you feel worse. So then you go around in that spiral again. So it is really important just to slowly but gradually build up your exercise. What to do depends on your symptoms. So if you are finding that you're getting really dizzy or hypertensive or have difficulty exercising standing upright, you could try swimming. No, it's not for everyone, but swimming is a great exercise to do. Anything that's what we call semi-recumbent or recumbent, so you're not straight, you're not standing up straight. So cycling, you're seated, recumbent cycle. If you're going to the gym or thinking about using a gym, you can use the rowing machine or erg, where you're sitting down for that. So those sort of activities are quite good for those who are finding it difficult to walk or to do any type of upright exercise. Anything else for you to add, Gerry, that I might have missed out? Or
It's pretty comprehensive.
good luck with
good
it.
Good answer.
Thanks, Jane.
Yeah. No, but really important that you don't jump out of bed having recovered, feeling great one day and just try to run a marathon. As Jane says, you've got to build stuff up.
And if you find, because as Gerry's mentioned, long COVID doesn't all necessarily go in a line. You might feel really good, feel like you've recovered, and then suddenly feel much worse, and then recover again, and then have another dip. Or you might just never quite get back to where you were initially, or things vary a lot. So if you find that your symptoms are worsening, you can stop, have a week's rest, start again at that 5 to 10 minutes, and gradually build yourself up again a second time. So it's a bit of patience and a bit of persistence, but it is really important and worth it.
Thanks, Jane. So we have 2 questions about recurring pericarditis with long COVID. Is there really nothing that can be done for it? And what are the pros and cons for taking colchicine?
Yeah. Colchicine?
Colchicine?
Yeah.
Colchicine? Did I pronounce it right?
Yeah. So pericarditis. So it's a really important question, and we know quite a bit about pericarditis from other viral infections specifically. We know that it's not uncommon to get inflammation of the lining of the heart after a viral infection, and certainly it's well documented, described with COVID-19. More so than inflammation of the heart muscle, which is myocarditis. It's an inflammatory condition, so it probably doesn't come as any surprise. The mainstay of treatment is anti-inflammatories, so simple painkillers and drugs like naproxen to begin with, and it will settle down often in a lot of people with that. Some people it doesn't settle down, and that's when we look at colchicine. And we've got several trials telling us that colchicine reduces your likelihood of having recurrent pericarditis. So if you don't take colchicine, you've had one episode of pericarditis, you've got about a 20 to 30% chance of having another episode. Once you get to the second time, you've got a 50% chance of getting another episode, okay? So you want to try and prevent that happening. And colchicine reduces the risk of having it again by a 3-month course of colchicine, one tablet twice a day, reduces your chances by about 50% of having it again. It's a pill we've got lots and lots of experience with, not just with this. In fact, our main experience is in treating gout, and we tend to use slightly different dosing regimes in gout, where we tended to increase the dose until people got side effects from it. That's not how we use it in conditions such as this. We give people 1 tablet twice a day, and most people tolerate it with no side effects at all. Some people can get a bit of an upset tummy, feel a bit nauseous, a bit of tummy discomfort, and diarrhea tends to be the main limiting symptom, but we don't see it as often as we see it when we use it treating.
It's lower dose.
Yeah. So I think I think it's a very important treatment in someone who has had a prolonged pericarditis to prevent the possibility of recurrent pericarditis. And even if you've got recurrent pericarditis, it actually helps prevent a 3rd or a 4th episode. Need a slightly longer course, usually about 6 months. But yeah, I would encourage Danielle, if it is something that you're. No, this is a different question. Sorry. Yeah.
Thanks. So Daniel asks, should people who are suffering from long COVID and having cardiac symptoms be seen by a cardiologist, or is GP care sufficient in most cases?
Yeah, we were talking about this before, weren't we, Jennifer? I mean, I think the answer is it depends. I think a lot of symptoms tend to be short-lived and appear to be resolving. I think seeing a GP initially is really the go-to person, rather than going directly to a cardiologist. But if you've got symptoms that are ongoing or of real concern to you, for example, you're getting chest discomfort when you're doing things, if you're getting lots of troubles and palpitations, then it's likely that your GP will refer you on to a cardiologist. Because don't forget, we talked about it during the presentation as well, people who have been exposed to COVID may develop new health conditions such as angina, so it's really important that all these clues are followed up on, because there is no test we can do to say that what you're coming to see me about is due to long COVID. Jane?
Right. Yeah, exactly. A tip for people who are having some cardiac symptoms and they're concerned that it could be due to having had COVID or a second COVID infection, it would be to help your poor old GP along a little bit. Perhaps you can keep a symptom diary, so just write down.
Really important point.
Write down in a notebook the time of day, what your symptoms were, what seemed to trigger them, if you have any idea. What seemed to help them to go away, and just to have a little bit of a history will really help your GP to just sort of either rule out or have a bit more of a clue as to what might be going on for you. They might decide if they think, yes, this does sound like cardiac symptoms, and they want to follow up a bit further, they'll probably do an ECG. They probably will send you to have a blood test to look at an enzyme called troponin that might give an indication that your heart might be suffering a little. And then if those tests come back when they have concerns, then they will likely refer you on to cardiology services, to a cardiologist who may want to do further tests. So help them out there if you can just give us some clues with writing out that symptom diary.
Okay, so Yvette has a question. Has long COVID and has developed POTS and dysautonomia, if I pronounce that correctly, dysautonomia. What are the long-term ramifications of these?
Are you going to tell me what POTS?
Stop it!
We touched on it briefly during the presentation. POTS specifically and dysautonomia, some people would lump them together. I mean, we tried to differentiate a little bit between them. Again, cardiac deconditioning, what happens when you stand up. You can get a increased heart rate, which is a little bit more than we would expect normally, to maintain blood flow to the brain, and that can cause symptoms of dizziness, lightheadedness, and tachycardia. Nausea. Yeah. So it can be a difficult. Firstly, it's a difficult It's a difficult condition to diagnose. Dysautonomia may be associated with POTS. Typically, the blood pressure doesn't fall.
That's
but
right.
Dysautonomia, blood pressure may fall as well. So there's different variations of this, but more often than not, they result in the same symptoms that we just talked about.
Similar treatment too, isn't it?
Yeah. Do you want to talk about the treatment, Jane? Because you guys at the Heart Group have a wee bit of experience with this.
Yeah, so I see the dysautonomia as sort of the umbrella term, and POTS is one of those conditions within that, and it just means, as we talked about before, a disruption or a problem with your automatic system that would normally do it without thinking, adjusting to changes in postural position. POTS, it stands for postural orthostatic tachycardia syndrome, and often, particularly, is a condition that, for some reason, is more likely to happen for women. Anyway, whether it's to do with COVID or not, and often younger women as well. The great thing about POTS is that for many people it is a condition that will improve, and for a lot of people it will disappear, and others will manage their POTS for a lot longer or lifelong. The treatment really is just to keep up fluids, because obviously you want volume, so you want to be able to keep and maintain a good blood pressure, and reduce that need of your heart to try and increase its heart rate and to help it out. So 3 litres a day, depends on other underlying conditions too, so you do need to check this out and get that advice from your GP or cardiologist or specialist. But generally you want to be drinking lots of fluid, you want to have a little bit of extra salt as well to get that fluid in your vessels. Reduce the amount or watch the amount of coffee or alcohol that you're having, because we know that coffee and alcohol does contribute to dehydration. It's a bit of a little gentle diuretic. You can also look at raising the head of your bed 10 to 15 centimetres, so you're sleeping slightly upright overnight, just to help again keep that fluid in circulation, keep that blood volume up. It's not much fun, but for some people, wearing support stockings helps. Those big long ones that go all the way up to the waist, and unfortunately they do need to go all the way up the leg, not just those little ones that you get up to your calves for DVT prevention, or you might wear on a plane. So, but instead of that, if you don't really want to be going out in these big white stockings all the way up to your waist, you can just use cool leggings. So for men and women, so your exercise gear, your stretchy pants, they really also do help as well with circulation.
Yeah, I think the other thing is understanding, what's going on, and more importantly, what's not going on. I think that's important. I tend to simply recommend good hydration, avoiding, becoming dehydrated, particularly in hot weather. And support stockings. Yes, they are useful, but as you say, they're
not much.
Yeah, they're not much fun.
But certainly with exercise, if you're exercising and you have POTS, or you have some sort of dizziness or dysautonomia, autonomic problems, then those will help with exercise. So that would be a really good idea. You can look cool in your sporty pants.
And experience from other conditions is often that they, as Jen mentioned, is they do settle down with time and understanding.
Yeah, that's right.
And I think that's really important to emphasise.
And the other thing too is just to avoid large heavy meals, because it's diverting blood to your stomach rather than around your body. So there's a few little tips anyway that may help for some people.
Okay. So Karina says, I'm 9 months post-COVID positive date and still getting lots of symptoms. I have constant chest pain, but I have had chest x-rays, ECG, stress ECG, blood's all normal. Are we missing testing something?
Oh, sorry, Karina, that's not much fun for you.
Well, it's difficult to give full advice, Karina, not knowing what tests have been fully done. I think the first thing, I'd assume if you've had a stress test, you have actually seen a cardiologist. I think someone with symptoms such as yours, with ongoing persistent symptoms over a quite prolonged period of time, I think this is where I would recommend seeing a cardiologist. I think the investigations that are listed there, if they are all normal, I'm assuming that the cardiologist probably has done an echo as well. All of those things, we've just got to sometimes stop, think again, and say, is there anything else that we might need to do? Constant chest discomfort is often not due to blockages in the arteries. I think that's something to me that, if you're getting pain there all the time, that's less likely to be due to blockages in the arteries. But again, it's worth just pausing and thinking and just seeing what else might actually be going on.
Whether it's a respiratory condition, Karina, that it might be something that is becoming more recognised as a common problem or side effect of COVID-19 or prolonged COVID is dysfunctional breathing, where you just almost need to go and see a respiratory physio and just be taught some really good breathing exercises that might help with that chest discomfort.
Yeah. Well. Again, following on, I'll read this question because this actually may, So Natalie says, I started having breathing issues last October. I never tested positive for COVID, but have had a continual cough. So it's possible you have had COVID. I've just had a procedure to look at my aortic valve, and it all looks okay. It's a mechanical aortic valve. I know it affects my lungs and hearts, but should I be concerned that nothing is showing up? I'll turn that around a little bit, Natalie. Firstly, I think the fact you've got a mechanical aortic valve and the TOE shows everything looks good, that's reassuring. I assume the docs have had a look at your heart muscle with the TOE or a conventional echo as well, and assuming that all looks okay. Breathlessness can be due to other things, as you know. Sometimes we see angina, that breathlessness can be a presentation, a variant of rather than chest discomfort itself. And I'm assuming the docs have thought through all of that as well. I think I would be reassured if all those tests are all okay, and we've looked at your lungs as well with breathing tests, then I think I would be reassured by that.
Yeah, it's not much fun for you again, Natalie, because you're still having breathing issues, or you've had it since October, so we're now March. And again, and I'm sure you've tried things like regular exercise just to improve your lung function and your respiratory function. I don't know whether it's worthwhile with seeing a respiratory physio. That makes a difference to your chest discomfort. And hopefully, I'm sure that the cardiologists have done their due diligence and looked at all the other possibilities as far as your heart goes. So hopefully they'll be reassuring rather than concerning for you.
So Marie is asking, are people with PFO more prone to having a heart attack while they have COVID? Gerry, can you explain this for us?
Yeah, sure. So what a PFO is, it's between the two collecting chambers in the heart, what we call the atrium, on the back of the heart, where the blood comes back from the lungs and from the veins, the rest of the body. There's a little wall between them, and there's a little communication between those two chambers that we're all born with, but closes very quickly after birth in most of us. I say most of us, about 20% of us are left with a PFO. So 1 in 5 people, this is something that doesn't close. Mari, to the best of my knowledge, I am not aware of any association with heart attacks and PFOs in people either with or without COVID, so I would be reassured by that.
I agree.
Okay, so Tanusha asks, if a COVID infection can cause diabetes for people who are otherwise non-diabetic, why does COVID lead to high blood glucose readings during and after a COVID infection? Is it temporary? What's the best way to manage the spikes?
So is this someone, Tanisha, are we understanding that you're not diabetic, but you're getting spikes in your glucose readings, or have you got diabetes from the COVID infection?
Yeah, so I'm assuming that Tanisha doesn't have diabetes and is asking the likelihood of diabetes occurring. It's a really good question, and I actually looked up a little bit about this, and we firstly we know that if you've got diabetes, established diabetes, and you get COVID, you are more likely to have a serious illness with COVID. So again, really important we recognise that. People with diabetes in some recent literature are thought to have about 4 times more likelihood of having long COVID as well. So not just a more serious illness with COVID, more likely to have long COVID. We don't actually know if COVID causes more diabetes, be it type 1 or type 2, but there appears to be an increased risk of both type 1 and type 2 if you've got a COVID infection. But we don't know if it's cause and effect. But if you think through it, and why that relationship may exist is because the virus may be attacking the pancreas. There's inflammation, there's all sorts of things. But there is an association that we don't fully understand with COVID and diabetes. So diabetes and COVID, more serious illness, more likely to get long COVID. And if you get COVID, there is a documented small increase in diabetes, both type 1 and type 2, which we don't fully understand the rationale behind. High blood glucose, if you're unwell, that can happen. So any serious illness can put your blood glucose up, and it does tend to be temporary for the vast majority of people that happens in.
Okay. So Karen asks, do the antivirals play a part in preventing long COVID? My COVID was very mild because of them.
Do you want to answer that? Or do you answer that?
Well, I'm not sure who's still. Has it changed as far as who's eligible to? Is it still over 65 and they need to have pre-existing conditions as far as who's eligible to be able to access antibiotics? I feel like that's been relaxed a bit.
Yeah, it has.
Yeah. And I can only say from experience. It was my 90-year-old dad had COVID and we took beta antibiotics. He seemed to be very mild, very difficult to know. So, yeah.
But I guess you answered the question yourself there, Karen. That's why the antivirals have been successful around the world. They mitigate the severity of the illness. So that's exactly your COVID is meant to be milder if you get an antiviral. To the best of my knowledge, and again in my reading, prepping for this meeting as well, I'm not aware that antivirals reduce the likelihood of developing long COVID at all.
Okay. So Pratika wants to know if there is any data on ethnic differences in people experiencing long COVID-related heart problems and myocarditis, and how is the data being used to inform and resource health practice?
Yeah, again, a really good question, and we don't know in New Zealand currently. That's some of the stuff that we will learn with the work that Jim mentioned is ongoing, the registry data and the other data that we're collecting in New Zealand. We did mention, particularly in the presentation, that overseas that there does appear to be, people who are at higher risk, lower socioeconomic groups around the world tend to be at increased risk of developing long COVID-related complications. Not aware of any ethnic differences that have been described in the United States, for example, where we've got probably some of the more robust data available to us.
And for our New Zealand populations, we haven't really got that information.
Not yet.
We're just a little bit early as far as getting the results of research this year.
So it looks like we've covered all the questions we have time for. So sorry if we didn't get to yours. Gerry or Jane, is there anything else you wanted to cover before we wrap up?
Yeah, Jen, over to you with respect to, the future and people with long COVID. We talked about this a little bit beforehand. Our understanding is that for the vast majority of people with a long COVID syndrome, is that over time symptoms will improve.
Yeah, I agree, Gerry. I think I do want to acknowledge for anyone that's listening, and many of you I suspect who either are suffering from long COVID or wonder whether they are suffering from long COVID, that it's just a really horrible place to be. It's really uncertain. You feel that no one understands, and your symptoms can be quite different from anybody else's, and sometimes it's really difficult to get answers, to be acknowledged this is a real thing, and it makes you feel quite isolated and lonely. So I really want to acknowledge that it's really not as a difficult situation to be in. But I would say, you know you better than anyone else, and so if you feel like you're not coming right or things aren't right and you don't feel that there's a really good reason, there's nothing else that you think of or your GP has found that can answer that, I do think it's worthwhile persisting to get those answers. So if you can do that yourself, or if you can bring along a friend or whānau member or someone to come in and help you listen to what your health professional has to say, write down your symptom diary so you've got something here to show people. I think that's really helpful to try and get through. Certainly, most long COVID sufferers do get better with time, and I know that takes patience as well, because that's not always easy. The symptom diary is not only helpful for your GP, but I would recommend keeping a diary anyway, and as much as you possibly can, focus on what you can do rather than what you can't do. So, and it's nice even just to see incremental changes and celebrate those. So maybe a month ago you were so tired you couldn't even move out and put your rubbish out, but now you can, and you're able to talk to your employee about perhaps changing your job, or changing your hours, or adjusting what you do so that you still feel like you're able to be part of society and be able to take part in it. You might be able to do the job you used to do, but perhaps there's something part of that job that you can do. So just finding solutions, adjusting to this new normal for as long as that is.
I think the other thing is that we're all learning, we're all continuing to learn, and that includes health professionals. And you may well have read a lot more around long COVID, and be aware of it more than your health professional. So it's important that we're all learning together about this.
That's quite right.
Okay, thank you. Thank you everyone for joining us. We appreciate you being here. It would be amazing if you could give us some feedback on this session through a short survey in our event description. Please join us again next time on the 12th of April, where our nutrition advisors, Lily Henderson and Dave Monroe, will be answering your food questions. Thanks again for joining us today, and we'll see you next time.
Bye.
Thanks everyone.